It's my pleasure now to welcome in the State Health Officer, Dr. Scott Harris, joining us now from Montgomery. And Dr. Harris, thank you so much for taking your time to join us, sir.
Sure. Thank you for having me today.
Just wanted to get an update from you, sir, about where we are in the state of Alabama in this fight. Are we seeing now that 14-day decline that the CDC is looking to see?
I think in most parts of the state we are not seeing that. We think that we have increasing numbers of cases in multiple counties at this time.
The fact that we're not seeing that trend down that everybody wants to see. I know, the governor certainly, she expanded the safer at home order. Do you believe that we've just got too many people out there that are not abiding by the safer at home orders, the amended safer at home orders, as far as social distancing, masking up, washing hands, personal hygiene, things like that?
I think clearly that's got to be part of it. We know that we've increased testing in most parts of the state, and so to some degree we may be picking up more people because we're testing more. But in fact, we're picking up cases who are out there that we just didn't know about before. But I think obviously as the economy begins to open up, every state now is opening up to one degree or another. As more people get out in public, I think people probably are returning to their normal behavior. It's really difficult to get people to change behavior. We enjoy being social. We enjoy doing things in groups. There are many, aspects of our lives that involve being around other people. And I think clearly that's posing some risk for increased disease transmission. And I think that's what we're seeing.
So if we are not hitting that 14-day declining scale that we want to see, that must bring concern to you, sir, about the fact that we could have a rebound effect with the coronavirus this fall.
Yeah, I think we're all worried about that in a way. We certainly are seeing hot spots in certain parts of the state as well. We've seen outbreaks associated with nursing homes, for example, or with poultry processing facilities in different parts of the state. We're also seeing some cities that are having some hospital capacity issues, that they've been able to manage so far, but are still, somewhat concerning. Here in Montgomery, where I'm based, we've had that issue recently. I'm sure you've heard about. We've seen that in other cities as well. So as the summer progresses, as more people tend to get out and get more active anyway, I think we're really need to be on high alert to see what happens from that.
Doctor, let me ask you this. What are you hearing nationally as far as potential vaccines? Which ones do you think show the most promise? Would it be an antibody or would it be something else?
Yeah, there are a number of different candidate vaccines out there, and really at this point, I think it's too early to say. There was a vaccine that was developed for SARS, the virus that causes SARS, back in 2003, 2004, and actually that vaccine sort of came finally to development after that disease had already sort of disappeared. But certainly the work that's been done with that vaccine as a basis, offers some hope, because SARS was also caused by a coronavirus, just like the one that causes COVID-19. But there are other products out there as well, and it just it really goes to show how much effort it takes and how much time it takes to develop a vaccine. It's fairly simple to come up with a concept on paper, but really putting that into practice and getting that safety data that you need and getting that effectiveness data that you need really takes quite a long time. So I would say at best, what I read is that we could have some candidates that are going in fairly large-scale testing by the end of the year. But that's really optimistic, and probably is going to be, closer to 10 to 12 months from now.